familiar word, but do we know what it really is? Today, 12th of October, a day established as a World Arthritis Day. Let's compare the myth and misunderstanding, and let's know it from a scientific truth part of it from the expert. Today, we have with us as somebody who has changed the course of education and awareness among students as well as the patients. It's a privilege to know you and, of course, spoken to you, Dr. Devashish Tanda, President, Asia Pacific League of Association for Rheumatology. We thank you, sir, for joining us.
Thank you.
Sir, today being the Arthritis Day, is there something that you want to start off with?
I just want to show you by a simple slide how important are the arthritic conditions in real life. If you can see the screen, this is a pie chart which shows the distribution of diseases starting from communicable diseases, neurological diseases, respiratory, cardiac diseases, cancer, injuries and accidents, mental and behavioral disorders, and musculoskeletal disorders. You can see it that the almost half this is occupied by musculoskeletal disorders and mental disorders together. Almost 25% of all the illnesses or the people who live with disability are suffering from either musculoskeletal disorders or arthritic conditions, as we call them, or mental disorders. So they are far more common than we think. And there are lots of misconceptions and myths about these patients of arthritis, which often get them confused and get misdirected, and their diseases get undiagnosed or underdiagnosed or misdiagnosed, leading on to complications, damage, worse quality of life, loss of function, and financial loss, as well as loss of man days. So therefore, this picture shows how important are musculoskeletal disorders or arthritic illnesses in terms of one's daily activities of daily living and productivity, as well as suffering, morbidity, and even mortality. Thank you.
True, sir, that's right. It's a lot of myth and misconceptions that we have. And we did have a survey taken, and there were quite general questions that come out. So, the most asked questions, if you don't mind, can we share those questions to you? And maybe you can highlight us all the misconceptions of. Yeah? So, one of the most common questions asked to us was, what is arthritis and how common are they?
The second part of the question I have already answered by showing that almost 25%, 23%, as good as 1/4 of all the people living with disability are because of arthritic conditions or musculoskeletal disorders, as they are also called. So it's very important. But what are arthritis? The word arthritis actually means inflammation or swelling in the joints. However, it's sometimes little loosely used, that it need not be always inflammation. There are several different mechanisms which causes pain, swelling, limitation of movement, restriction of mobility, damage, deformity, and loss of function. All these things are put together which affect the joints are called arthritis. So arthritis is joint related pain and inflammation due to several causes.
Okay, because our second question was also related with the joint pain. So the question from them was, is every joint pain an arthritis? Or, there's a difference in that.
That's a very nice question. The word joint pain, strictly medically, should be called as arthralgia rather than arthritis. That is, a joint pain need not be always due to joint inflammation. It may be a self-limiting joint-related problem, like it happens sometimes in viral fever and others, which transiently lasts and it goes away. Whereas a pain in the joint may be felt as a referred pain from somewhere else. Like if somebody has a gallbladder pain, which is around the right side of the upper abdomen, may be referred to the right shoulder. So it may be felt like a right shoulder pain, but it's not actually a joint related pathology. Similarly, sometimes a knee pain may be felt more on the hip joint pathology pain may be sometimes referred to the knee. So every joint pain is not always due to joint inflammation. There may be some transient factors, there may be unrelated factors, or they may be because of some other problems in the system, like you can have a disease called fibromyalgia. I'll show you a few pictures later, where people have widespread aches and pains in the muscles and other tissues, or there are sometimes pain in the ligaments and tendons, which may also are referred around the joint, which is also may be called as a joint pain. So every pain in the joint which is perceived by an individual is not necessarily an arthritis, but majority of them have got something to do with the joint. Thank you.
Thank you so much, sir. And the next question is something they're asking, isn't anything to worry? So if one has a rheumatoid factor or a high uric acid or even a high SAO tier, is that something that we need to worry about?
That's a very relevant question. It's one of the misconcepts which are transmitted even in the doctors' minds who are not specialized or trained in rheumatology. A high or a positive rheumatoid factor is not synonymous with rheumatoid arthritis. A rheumatoid factor may be positive in about 15% of elderly population, 5% of normal population of at any age. They may be also positive in infections like tuberculosis, leprosy, even HIV. They may be also positive in several other conditions other than rheumatoid arthritis. So a presence of rheumatoid factor do not confirm the diagnosis of rheumatoid arthritis, nor the absence of rheumatoid factor rule out rheumatoid arthritis. For example, up to 20% of population with rheumatoid arthritis may be negative for rheumatoid factor by test. So it is one of the associated findings. It's not diagnostic feature of rheumatoid arthritis. Similarly, a high uric acid does not always mean gout. To call it gout, it is the uric acid salt called monosodium urate, which gets deposited in the joints and causing inflammation and pain, which is called gouty arthritis. But you can get high uric acid in many conditions. It can go up in conditions like psoriasis. It can go up in patients who are taking water tablets for blood pressure. They can also get high uric acid. There are several other drugs which can also increase the level of uric acid. Many cancers sometimes also can increase uric acid because it's a reflection of cell turnover. So therefore, a high uric acid is not synonymous with gout. However, if you can demonstrate the crystals of uric acid salt called monosodium urate from the joint fluid, or sometimes nodules are present in uric gout patients, if you take the fluid and examine under a special type of microscopy called polarizing microscopy, one can see needle-shaped crystals, and only then, as well as some characteristic clinical features of gout has to be present. A simple high uric acid test means nothing to me. So, same way, the high ASO titer is not synonymous with rheumatic fever. I must also tell you that the rheumatic fever is almost going away, even in children, because of widespread use of antibiotics, which used to follow streptococcal throat infections, but it's now going away because of widespread use of antibiotics. But high ASO titer means one has been exposed to a streptococcal throat infection or sometimes skin infection. So if you have a high ASO titer, it just means that. However, to call it rheumatic fever, there are some clinical criteria to diagnose. So you have to fulfill those criteria, not just ASO titer alone. So ASO titer is just a supportive evidence, it's not diagnostic. And in fact, these days we should not do ASO titer, especially after the age of 15. One never gets rheumatic fever. So we should never test this unnecessarily, adding unnecessary anxiety. And therefore, I would like to say, as a doctor, we should be treating patients, not the lab results. Treating uric acid or treating ASO or treating rheumatoid factor is as good as treating the lab test, not the human being. So we treat the human being with flesh and blood with some signs and symptoms, fulfilling classification criteria for some diseases. We just simply don't treat lab test results. If we do unnecessary test, you get unnecessary test results. It may be positive, adding to anxiety and not adding to any benefit, neither to the doctor nor to the patient. Thank you.
True, sir. I mean, anyone goes with tests, they do create an anxiety. Oh my God, I'm having something. So thank you for that message. And yes, now the next common question that we had was, what are the types of arthritis? Like, how many types of arthritis are there?
It's a very good question again. There are more than 106 types of arthritis which may be there. But out of that, broadly, we can classify them. The arthritis, as I mentioned, can be by definition, arthritis means inflammation. So it may be an inflammatory disease of the joint when the lining of the joint gets inflamed and it causes damage in the cartilage and the bone. And this is a typical which happens in inflammatory arthritis like rheumatoid arthritis, psoriatic arthritis, etc. There are also arthritis which I've mentioned to you like gout, which is because of crystals of uric acid called monosodium urate. In those conditions, it's a different type of inflammation. It's also inflammatory, but it's not the classical autoimmune inflammation. They are called auto-inflammatory inflammation, where it's a very aggressive, quick response of the body as against when these crystals are being recognized, giving rise to when they're processed by the cells, particular types of cells, which can expose some proteins which the body vigorously responds. When we are born, we have two types of immune response. One is called innate immune response, other is called adaptive immune response. So the innate immune response is something like aggressive response. Without thinking, it will just attack. And that's how it happens. Like if somebody is coming by the side of yours and suddenly tries to put the finger on your eyes, even without seeing, you'll immediately close the eye. Nobody tells you to do that. The same way, the innate immune response is something like that. It aggressively responds with some typical pattern of inflammatory injury. So when he sees, okay, this particular protein, I must attack. So the immune system attacks immediately. So gout is that kind of arthritis of the innate immune system. There are also arthritis because of degenerative joint diseases, which are like wear and tear phenomenon. With age, with overuse, you get osteoarthritis. Have you heard of it? There is very little inflammation there. It's more of cartilage and the bone damage, which happens because of certain wear and tear phenomenon. Like, the footballers who play football, they don't have to get 80-year-old. Even at a young age, they can get bone damage. and osteoarthritis. So what happens is repeated injury or trauma, and wear and tear phenomenon cause modeling and remodeling of bone, giving rise to a type of arthritis which is not frankly or overtly inflammatory, though they have some degree of inflammation. That is like osteoarthritis. You may also get arthritis of the spine. We heard of ankylosing spondylitis. You might have seen on the street once in a while somebody who turns like this. The whole, if you turn, he has to turn the whole body. If you turn to the left side, turn the whole body. So the spine is like a stiff bamboo. So that is called ankylosing spondylitis. Or there are some related diseases to ankylosing spondylitis. They are broadly called spondyloarthritis or spine-related arthritis. That is another group of arthritis. You may also get arthritis because of infection, tuberculosis, leprosy, HIV, bacterial infection causing septic infection of the joints also can cause arthritis. Those are infective arthritis. So similarly, there are also some metabolic arthropathies. So those are truly called arthropathies than arthritis, like hypothyroidism and diabetes. They may also cause some damage in the joints, and those are either joints or the related tissues around the joint, or peri-articular tissue they are called, and they can also cause some arthritis, and those are like metabolic disorders. You may also rarely get arthritis because of cancer cells, which may cause reduced platelets or alter the clotting factors and cause bleeding in the joint, or they may cause infection, or they may sometimes cause direct metastasis or invasion of the joint lining and damage the bone and the joint lining. So they can also, they're called paraneoplastic arthritis. So similarly, there are different, there are also some hereditary and genetic arthropathies. Some diseases where joints are very flex. If you see in your office or in your family or among your friend circle or in your workplace, out of 100, 4 or 5 people will have very lax joints. They can extend their fingers beyond normal what you can do, or they can touch their thumb on the distal forearm. They can touch the floor without bending knees with both hands with outstretched palm. So very flexible. These are the people who are very successful gymnasts, or they can do acrobatic activities, or they can do good dancing with all kinds of movements. They bend, look scary. Sometimes you see on one of the reality shows in television. So those are the people who are born with flexible joint. It's nothing to be being, I mean, this is not a truly a disease, but sometimes there may be diseases also. So they're called hypermobile joint. So they're also called benign hypermobile joints. When they cause no problem in life, they can go on normal life. But there are some of them, very few of them, have some genetic disorders. They're very tall, very flexible joint and skin. They may have heart valve problems and other complications like Marfan syndrome, they're called. So there are some hereditary disorders also which can cause arthritis. So you can have all these types of arthritis, and there are many other different types of varied causes for joint pain and joint deformity, which I'm not going into it details. But what I am trying to say that there are many types of arthritis, and broadly they may be inflammatory, they may be infective, they may be degenerative, they can be spine related arthritis, they may be genetic or hereditary arthritis, they may be because of innate inflammation or crystal arthritis. And similarly, there are also joint pains because of certain pain sensitivity problem. Like there are some people who, if you touch them, they just do ooh, like that, and they have hypersensitivity to pain. If they are not malingering, they're not acting, they're not telling lies. They have very sensitive pain pathway, so they have more pain than usual pain perception. Even with touch, they get pain. So that's called fibromyalgia or chronic pain syndromes. So there are all kinds of arthritis. I can go on like this. Thank
I do understand. You did say in the beginning there's a lot of type of arthritis, but that's fine because you've given us a brief understanding on these types. But there was another question that came up with our patients, what they said is, do arthritis affect any other system in the body other than joints? Because we all talk about joints.
Very, very important.
Yeah.
So, like for example, rheumatoid arthritis and connective tissue diseases, they actually affect multiple systems in the body, from heart to lungs to kidneys to brain to nervous system. Practically every system can be affected. In fact, rheumatoid arthritis is an independent risk factor for coronary artery disease or heart attack, like diabetes and like hypertension. Rheumatoid arthritis can affect lungs, causing scarring in the lungs. So there are all kinds of complications which can happen in many arthropathies, especially those who are systemic autoimmune arthropathies like rheumatoid arthritis. So it is important to treat these conditions, because if untreated, they not only damage the joints, they can also affect major systems in the body, causing significant morbidity and even mortality.
Okay. Now that's a very good piece of information for us. And another question from the survey was, are arthritis illness curable? I mean, is it going to be with us all the time, or we can cure it?
This question, I must first explain the word cure has lost its conventional meaning. For example, you can get cured of cough and cold and diarrhea and dysentery. You can get it 1,000 times in your life. So you can also get a diabetes and hypertension, which are maintained well on medications and lifestyle, and they can live a normal life. If not treated, diabetes and hypertension can kill by heart disease or stroke or kidney problem or eye problem and nerve problem, etc. So on the other hand, if you are treated cancer and the cancer cells do not appear within 5 years, it's called a cure. So the word cure is become very relative and it has no meaning. So basically, what we need to have is good quality of life, even with the disease like diabetes and hypertension never go away from your body. You treat them, you keep them under control, but you stop the treatment, it will bounce back again. The same way, like in rheumatoid arthritis and systemic autoimmune other diseases like lupus, if you treat them, 90% patients, more than 90% can actually have a near normal life with small ups and downs. Preferably they are properly treated and monitored by an expert like a rheumatologist, and they are under close monitoring. And this is the most important factor to remember. And if they stop treatment and keep they try experimenting on themselves, then let me try, I'm doing well, let me stop the drug and see. That's the most dangerous thing to do. And that's the most dangerous thing to do in terms of bad outcome. So the word cure may not have much of meaning, but what I can say is that what is now people are trying to achieve in rheumatoid arthritis and all arthropathies is to achieve a quality of life, a good quality of life, or low disease activity, or what is called remission. Even in cancer, it's called remission initially. The word cure is much more, what shall I say, uh, categorical. And I don't think we can always achieve a cure for most diseases in life. So it doesn't matter. Even if you're not cured, to you, it may feel like cure, but to doctors, we don't call it cure on
True.
treatment. Thank you.
True. But as far as you're there for treating us, I'm sure we all are on safe hands. And one of the worries that we had on a patient talk was, uh, do these illness go run into their families as well? This was one of the worries. So, is it something like that?
It's a very common question everyone asks. So almost all the autoimmune rheumatic diseases, again, like rheumatoid, lupus, and similar arthropathies, ankylosing spondylitis, there is a high familial aggregation in this condition, but it is not, there is genetic factors in that which makes someone susceptible, but it is not hereditary that way. That means when you say hereditary, we mean Mendelian inheritance, that if you have autosomal dominant, autosomal recessive, In autosomal dominant, there's a 50% chance of transmission in each child. Autosomal recessive, less than that. It is not that. It doesn't follow that pattern. But it has been found, and there are lots of studies which show that rheumatoid, lupus, psoriatic, ankylosing spondylitis, even gout, they run in families in such a way that there is a stronger familial aggregation or familial association. So if we see patient of ankylosing spondylitis seeing us, and we see the father standing behind, and we can spot diagnose he's got ankylosing spondylitis, and because he has been managing taking painkillers but never consulted a doctor, someone might have told him, oh, it's not curable, so just be like this, take painkillers. So there is familial aggregation. There is a chance of higher than normal population transmission to the offsprings, either a same disease or a similar disease. For example, a mother may be having rheumatoid arthritis, the daughter may have more of say Sjogren's or lupus or some other autoimmune disease. So it need not be exactly same disease in the same group of disease, or there may be just by chance rheumatoid factor positive or ANA or anti-nuclear antibody positive. They may not suffer at all in the whole lifetime. So there is a familial association, but it's not always 100% in every child. So that should not discourage anyone from planning family.
That's a lot of good news for some of our patients because they were quite worried about this. And there's a misconception. So I'm sure this is going to clear that off. Another question what they had was, how do you treat them and how long is this treatment of arthritis? I know it's a disease, but still.
Again, the first line of treatment for treating arthritis patients is patient education. We must tell the patient, the rheumatologist must tell the patient that what is the nature of the disease. Like for rheumatoid, I'll say it is a systemic, autoimmune, multi-system disease of lifelong nature, controllable, but not curable in strict sense. But if you take treatment properly, it will be more or less like cure to you. With small ups and downs, you can do well. So first line of management is explaining the patient the nature of the disease. The second is we tell the patient that what happens in natural course of disease. Suppose I don't treat or I stop treatment, what happens to me? So you must tell the rheumatoid arthritis patient that if you don't treat, you may not only develop deformity, you may get premature heart attack, you may have kidney problem, lung problem, you can have nervous system problem, eye problem, practically every system in the body. The same thing happen for lupus and other conditions. Similarly, other conditions also, other arthropathies also have got several other associations. So tell the patient that these are the this is a long-term disease. It needs long-term treatment. And if you don't treat, this can happen. If you treat, you will still have some progression of disease, but it will be lot better, almost near normal life, especially if the treatment is started early. Now about the medical therapy, you have to explain the cost, the effect, side effects, and also the the various complications of disease on treatment. It's very important. I know I would like to take the liberty of explaining uh, two factors which influence the misconcepts. There is something called placebo effect. There's other thing called nocebo effect. The placebo effect is, suppose I tell you, if suppose you have viral fever, you're not feeling well. If I tell you just that, you'll be all right. Don't worry. In 2 days' time, in 3 days' time, you'll be all right. You will feel better and you may recover faster. If I give you a sugar tablet or just give you chalk powder tablet, just telling that just take this, you'll be all right. It may work the same way. So you have a joke saying that if you have a common cold, if you treat, you get well in 1 week. If you don't treat, you get well in 7 days. So basically, what I'm trying to say that if you believe something is going to help, especially things like pain has got a 30% placebo effect. Like if you believe the chalk powder tablet or the sugar tablet is actually an anti-inflammatory or painkiller, you will get about 30% benefit in pain control. So this is because the brain produces chemicals which are strongly influenced by your thinking and emotions, etc. But there is also something called nocebo effect. If you tell everybody in everywhere, especially in Kerala, it's very common. People believe in a lot of things in Ayurveda. So if you give a medicine from modern medicine, they will always say that it's got side effects, so I don't take it. Ayurveda has no side effect. So Ayurveda is benefited by placebo effect, and allopathy or modern medicine suffer from nocebo effect. Nocebo effect means you think anything you take from modern medicine has got side effect. So when it comes to that, I tell the patients that look, anything in the universe which has effect has side effect also. There is nothing in the universe which has only one effect, only good effect, and no bad effect. There cannot be anything, any substance. So side effects, if they are monitored or acceptable, it is acceptable. So the drugs which come in modern medicine, they come by initial animal experiments or lab experiments. Then they come to phase 1 trial, phase 2 trials, phase 3 trials, and post-marketing surveillance. So that is how the evidence-based medicine is generated. And by the time we know, so if you read a paracetamol tablet side effect list, there will be some 100 side effect written there. So when we have first time become doctors and intern, I'm afraid to give a night call. If I go to the ward, patient says some headache, I want to give, I may think of paracetamol may cause stomach bleeding and he can die. So I'll be afraid to give. I'll ask my senior, can I give you a paracetamol tablet? So this is how the people also think. So what happens is side effects are known in modern medicine and they're all described. Even if it is 1 in a million, it is still listed. But the people think that's going to happen to them. If that is the case, we cannot prescribe medicine. In fact, most of the alternative systems of medicine are not evidence-based. So they do not know what side effect they cause. So it's like a crow closing the eyes after stealing a soap and then believes nobody can see me, I'm stealing the soap. The same way is that in allopathy or modern medicine, side effects are there. It is there for anything also. In homeopathy, I have seen people taking homeopathy products having liver function derangements. I have seen people with Ayurvedic products having heavy metal poisoning with renal failure or a brain damage with tremors and speech defect. I have also seen a nerve damage with lead poisoning from the Ayurvedic drugs. I have also seen a frankly Cushingoid feature from basamam, which is made from the tree bark, which is burnt, produced ashes, and which contain mercury salts and cause mercurial toxicity. And plant steroids give Cushingoid appearance or puffy face. And if you ask them, have you taken steroid? They'll say no. So what I'm trying to say that anything we do not know, we believe it is not there. That's not true. And so that is what I'm trying to say. So first thing is the patient education. We must tell the patient of rheumatoid that you will take treatment, you will do well. But I cannot guarantee after 5 years or 10 years, you may develop lung problem or heart problem. That's why you need to come for 3 to 6 monthly follow-up. If not, what happens is if a patient of rheumatoid develops lung problem, which is part of the natural course of disease, in few patients, not everybody, he will think it is because of the medicine I've given. So the patient education is very important part. Now, after patient education, the next thing is the drugs. There is a whole lot of drugs. From the time I have done my rheumatology training 28 years back, there is so much of sea change. There's so much of drugs. Every year, so many new drugs come up, and they're all evidence-based. So there's a wonderful drugs which has completely changed the outlook of rheumatoid arthritis. In fact, when we are students, we were kept in the MBBS exam, a deformed hand like this to diagnose rheumatoid arthritis. Even a blind man can feel it and diagnose as a rheumatoid arthritis. But today, when you go for MBBS exam, look for cases, sometimes you don't find a classical case because with treatment started early, they do not develop those kind of deformities. So it is as good as that. There's so much drug. There are something called disease modifying synthetic drugs. There are called biologic agents. It is not painkiller story anymore. It is not steroid story anymore. It's a beautiful, there's so much happenings are there in rheumatology in terms of drugs. It's a fantastic opportunity, and rheumatological diseases and arthritic patients can look forward to very bright future. In fact, low disease activity and long-term remission, eventually cure, may become a reality maybe 10 to 20 years time. So it's pretty good now. Apart from drugs, patient also need to be, and patient education, patient also need to be taught some physical therapy or pain control initially, or preserving the joint functions. Muscles can undergo atrophy because joints are not used, so physiotherapy can preserve the functions. There are also many pain relieving physiotherapy. And then a very neglected and advanced disease, you need surgery. So we don't need so much of surgery if diseases are treated very well nowadays. So that's a fantastic thing, isn't it? So broadly, what I'm trying to say, our basket is full. The patient has so much hopes to look forward to in treating their arthritis today. Not only inflammatory arthritis like rheumatoid, even in other arthritis. Thank you.
So I'm sure that should have got a lot of fear out of the patients because, yes, you're right, the medical part of it. And I really like the sentence that, every effect has a side effect. So that's going to catch people's mind. So, just for the patients, what kind of lifestyle do you recommend for them? Because who are having this and they're going through the treatment, what would be the lifestyle as a doctor you would expect?
This is very, very important. And I must tell you that this is something we also need to do. It's not just patient education or physiotherapy or drugs alone. A lot of things depends on. Now, what happens is, for inflammation in our body, some chemicals are produced by two chemical pathways. They're called arachidonic acid pathway. And if the person is obese, or the person consumes a lot of rich food, high carbohydrate, high fat, saturated fat especially, they are likely to have more inflammation and more damage, as well as the comorbidities, like patients can, as I told you, rheumatoid can have heart disease, etc. more often. So diet is very important to have low carbohydrate. And if you see some of the Ayurveda shalas in Kerala, patients go and come back after 1 month, losing weight significantly. Their arthritis improves. How does it improve? It is by that. Once you control your fat and weight, it improves, because when you stand, the body weight falls on the knee joint or the ankle joint. Even simple things like mechanical weight bearing becomes less when you reduce your weight. So this is very important to do that. And sometimes, of course, too drastic weight reduction can be harmful, but overall we need to restrict carbohydrate and fat. Now, certain things I must tell you, which you'll be happy, and the friends in Ayurveda will be happy, people of this country will be happy. The spices in Indian diet, all of them are good. I must tell you that it's the middle class who lose out more often than the poor and the illiterate, because middle class have got a fashion of eating less spicy food. They want more fatty food, more calorie, more sweet, and they think spices are bad. No, none of the Indian spices are bad. In fact, not only turmeric, even chili, even your black pepper, coriander, all Indian spices have been found to have strong anti-inflammatory effect, as well as they have antioxidant property, and they protect from heart disease and cancer, but they also control inflammation. So please don't give up our traditional Indian food, Indian spices. Why India was attacked by the foreigners? For spices. People came to India for spices more than gold or anything else. And so the India spice is our national pride. So we should probably spice up our life by eating spicy food. If you have given up, please come back to original food habit of traditional Indian food. And in turmeric, there's something called curcumin. Curcumin is very potent anti-inflammatory drug. Of course, that will not be enough to control chronic diseases like rheumatoid, but this will also contribute. We have done a small study in Vellore on 400 patients with more than 2-year follow-up, and we found that those patients who have spicier food with rich in curcumin and other things, they also have a better outcome with the same medical treatment when you compare both arms. That is one. About chili, chili contains capsaicin, and capsaicin is an analgesic. So they actually increase the threshold for pain. So you see the sophisticated middle class people, they're very pain susceptible. You touch them, they get pain. But what happens is you eat spicy food, they blunt the pain receptor nerve endings, and they do not feel the same pain as you will feel without that. So capsaicin, there are capsaicin ointments which sometimes cause little burning for local pain and inflammation. So capsaicin and chili is also good. So spices, be proud of it. Eat it. Eat spicy food. So it's very good. Don't give it up. Other thing is a sleep. 8 hours sleep by night and 30 minutes sleep by day is very, very much needed, not only for this, for many things in life, for metabolism, for homeostasis. We need to have good, appropriate sleep. Breathing exercises, pranayama, or relaxation like yoga. Not everything. Don't do bending your joints too much. Something like savasana, they relax the body and mind and produces endogenous endorphins or enkephalins, which are like our natural morphine-like substances in the brain. So they keep us feel high and good. And how these sannyasis and sadhus feel very high, they feel high by these things. So they produce their internal opioids and makes us feel good. Apart from this, is also important. Stress is of course, modern day stress is unavoidable. Everybody has stress, but having some relaxed time is important, because stress can catecholamines also activate inflammatory pathway, and many lupus patients and rheumatoid flare up in stress conditions. So stress is also, so there are a lot more to lifestyle also. But one thing every Indian must realize, that give up fat and calorie, eat less rice, less chapati, almost very little fat, but eat your normal spicy food. That should be the traditional food is good. Thank you.
Then that's lovely. We can have a lot of spice. I'm a spice lover, so that should help me. So, just a concern that we already had answered earlier, but still, we wanted to know: is there any problems about fertility or pregnancy in arthritis? I know you had explained it, but there were a huge pain.
Excellent question. I would like to say that there is effect. In fact, uh, some of the conditions during pregnancy become worse. Some of the conditions become better during pregnancy. Like rheumatoid arthritis during pregnancy become quieter, because the pregnancy produces some chemicals or hormones and cytokines which actually control the inflammation. But soon after childbirth, they flare up. If you ask 100 rheumatoid women about their onset of rheumatoid arthritis, it starts after childbirth. Many people have first time onset of disease after childbirth. Also, the medications have to be altered 3 to 6 months prior to planning pregnancy. Every drug do not go well with pregnancy. They may affect the fetus, can cause abortion and other complications. So overall fertility, yes, overall fertility also partly reduced in most autoimmune rheumatic diseases. And it's a painful condition for people who have uncontrolled disease more than who have controlled disease. An uncontrolled disease, simply they cannot have the normal reproductive activities, and therefore they do have poor fertility. And there are also certain chemicals produced, inflammatory molecules produced, can affect the fertility. Especially in lupus, there is a high risk of abortion or miscarriage. In Sjogren's syndrome, there is a condition where you can have heart block in the baby in about 10%, in about 2% of pregnancies. And if it happens once, it can become, it can repeat in the subsequent pregnancies. So this is a reality. Some drugs, if not monitored, they can cause teratogenicity in the babies, or some drugs in men can reduce the sperm production, and they can also cause infertility. So there are many arthritic conditions where fertility is affected. But If treatment is properly done, disease activity under control, medications are altered by the expert rheumatologist prior to planning pregnancy well in advance. As I told you, 3 to 6 months prior, they can have a successful pregnancy and childbirth in many people. We have many, I would say more than 90% can actually have a successful reproductive life. When we were students, many lupus patients are told not to become pregnant because they're mostly women, and they were told that lupus flares up, but not anymore. These days we have many lupus patients with severe complications also. If their disease is controlled prior to pregnancy well, we can then change the medication which is suitable for pregnancy, and we can advise them to. So that's the thing. But yes, there are unfortunate few where everything fails and they need to do sometimes go for artificial insemination or in vitro fertilization, but that's a small percentage. Yes.
Okay. So that should clear up a lot of doubts from the ladies' part of you. So basically, who are we supposed to consult? I mean, I'm sure there's a lot of people who understood what arthritis is. So whom are we supposed to meet up?
This is a big question you've asked, and this is where even the governments fail. Most patients with joint pain go to orthopedician, but I must tell you, orthopedicians are surgeons. They're orthopedic surgeons. Their job is to operate. They are trained to operate a damaged or deformed joint or a bone. So the medical part, and as I told you, the 99% can be managed medically very well, should go to a rheumatologist who are the medical specialists for arthritic conditions. We have very few rheumatologists in this country. That is another reason why people go to orthopedicians. I would rather say that if a person has arthritis problem, it is better to go to a general physician than to orthopedician, because orthopedicians are not trained for it. So they can only see a patient of arthritis for operation when it is indicated. We can't subject everybody for surgery. Similarly, the medical knowledge for a rheumatological or arthritic condition of an orthopedician will not be optimum. So I would request to spread this awareness to people that for arthritic patient, they must first consult a general physician if they cannot reach a rheumatologist, but eventually they should see a rheumatologist and follow up at frequent intervals. Yes, we have shortage of rheumatologists in this country, but still, uh, as much as possible, we must see a rheumatologist, if not a general physician. For an adult, MD in internal medicine or DNB in internal medicine. For pediatrics or children, a MD or a DNB in pediatrics or child health. That is the first priority. But ideally, everybody should see a rheumatologist who may be a DM or DNB, or we also have fellowship programs in this country who are specially trained for 2 years in rheumatology. So it's a specialized field. There's a lot of advancements. A lot of new things are happening. So it is better to go to the appropriate specialists rather than getting lost uh, by visiting people who will see you because you have gone to them, but they will not be the right person to treat an arthritic patient.
True, sir. There was a few minutes back we've spoken about the surgery, but just to get in a little more detail, when exactly do we need a surgery in arthritis?
Yes. So the surgery of arthritis is the when the joint space in the joints because of chronic, untreated or poorly treated patients get joint spaces get narrowed, or they can get bent, completely fused or fixed. That hands become like that. So how can he eat? How can he use toilet? He cannot do anything with that. The same way, if the knee is bent, the bones are stuck to each other. They can't move, they can't walk, they can't sit, they can't bend their knees. So those are the people who have fixed deformities with permanent damage. They have to go for surgery. Sometimes tendon repairs, sometimes rheumatoid tendons drop, the fingers become lax, drop fingers, they're like that. So they may have to repair the tendons. Or sometimes small joints for housewives, they can use the kitchen work, they can be repaired by silastic prosthesis. So there are enough indication. And I can tell you, if a patient has treated medically well right from the beginning of the disease, especially within first 2 years of disease, they will have less and less chance of going for a surgery. Unfortunately, we have a lot of people with damage already happened, so they have to go for surgery. And the joint replacement of hip joints and knee joints are fantastic. They can be done in many, many centers. Many orthopedicians are experts in that, and they do a fantastic job. The first thing is the pain will go away. Second thing, their mobility will start, and they really brighten up after that. They get a new life. It's like a cataract. You change the lens and you can see better. The same way, someone who all the time in pain, cannot sit, cannot lie down, cannot walk, cannot stand, those are the people who will walk, and they'll be able to do lots of things. So yes, there are people who has got deformities and damage because of neglected medical treatment. They do need surgery, and there are all kinds of surgeries are available, for joint replacements to repairs of tendons to several other, like carpal tunnel. They may be compressed and hands are all the time paining, they can release the pressure here. So there are a whole lot of surgeries which are done by the orthopedic surgeons or the hand surgeons. When we have many good orthopedic surgeons in this country doing all this surgery.
Okay. There were a lot of people who did have a fear, when am I going to get a surgery? But if it is for a good cause, is what you said, I'm sure they're going to come up with that. So there's two more that we had to ask them. So we're not taking much time of yours. I just quickly booked up the question. They were asking, what are the authentic source of information that you would like to give the patients with arthritis?
Very good. One of the jokes among the doctors nowadays is called idiot syndrome. Internet derived misinformation. I don't know, full expansion, I forgot. It's called idiot syndrome. And most educated suffer from the idiot syndrome because there is no regulation over the internet. Anybody can upload anything. Today, you look for a cure for HIV or cancer, you will reach some quack or somebody somewhere. And if you see the amount of misinformation, it outnumbers in true or authentic information by hundreds of thousands of times or million times maybe. So how to know what is truth? How to differentiate milk from water when both are mixed together? So there are some authentic sources. So you must go for the professional bodies of medical organizations like American College of Rheumatology, British Society of Rheumatology, even our Indian Rheumatology Association. There are a whole lot of professional bodies, or top institutes like Mayo Clinic, that's like Johns Hopkins, like that. Every country and a lot of top international bodies have got patient education materials uploaded in their sites, and those can be seen easily. There are many in different languages. Uh, Indian Rheumatology Association also have many such patient education materials. There are authentic sources like this, what I've told you. But I think these are enough. If you go for American College, one more thing is there is a site called uptodate.com where there's a patient site. It's free for the patients. For doctors, it's paid. You have to pay. But for the patient site, is free, and they give authentic information. Uptodate.com or American College of Rheumatology is also another very good source. There are several others. So please go for scientific bodies to give you right information, not any such any false claims made by people who are not qualified to say such statements. Thank you.
True. And one thing that is a fear for all of them is arthritis something like a life threatening?
Generally, most arthritis are by per se, arthritis do not kill per se most of the time, except maybe septic arthritis. It can kill because the bacteria can spread all over. It can go to heart, brain, I can kill. Or sometimes bleeding into the joint, there are many causes for it, they can kill. But otherwise, the most arthritis per se do not kill. Having said that, autoimmune arthritis conditions like rheumatoid, lupus, etc., they have complications. As I told you, a rheumatoid patient at the age of 40 may have heart attack. A lupus patient at the age of 30 or 25 may have a heart attack and die if not treated. So they can have serious organ threatening complications involving major organs, especially heart, kidneys. Lupus patients can die of nephritis if not treated well. But I must tell you also, 99% of the lupus nephritis can become normal on treatment. It's only those few neglected or who do not listen to scientific advice, go for irrational therapy, they only end up into such complications. So majority do not die because of arthritis per se. Some people may be affected by complications of associated complications. Even there, only those patients who are not properly treated or properly followed up. And directly from arthritis is only maybe septic arthritis kind of conditions may rarely kill, otherwise not.
Okay, so we don't have to fear it as much as we all do. Thank you so much, sir, for giving us this time. And you're right, all the misunderstandings and misconcepts should have been really clear with all of us. So, is there something, a quick message that you want to say on the World Arthritis Day to
Okay.
conclude?
If I before I give the quick message, I'll just run through a few pictures for the people to see how they look like. This is one you have seen already, how the prevalence of arthritis affecting. I said about 1/4 of people with who are living with disability are because of arthritis. You've seen that pie chart already. So I have a few classical pictures I'll show you. So this is how rheumatoid arthritis, you see that lady on the left side. This is the early arthritis. So the new concept which has come is known as early diagnosis and treat to target. These are the two things which has made the outcome of arthritis very good, not just drugs alone. What is early arthritis? Within 3 months of onset of arthritis, if you diagnose especially rheumatoid arthritis, we never go to this phase on the right side. You can see, and it can become much worse. I have much worse pictures also. It will never go for deformities and damage and even other system affected if we treat the patients early in this phase or early arthritis. So rheumatoid arthritis picked up within first 3 months is the best outcome. 6 months still okay. 2 years somewhat okay. Beyond 2 years, many damages are established and many of the things will never become 100% normal. But having said that, even in very, very advanced arthritis, the treatment can improve quality of life and patient may be still pain-free, patient may still achieve a lot of good functions. But what I'm trying to say is that the window of opportunity is early arthritis. And how do we treat? We now have instruments to go by. We know when to increase the dose of medicine, when to decrease the dose of medicine. There are some clinical tools, there's some lab parameters, there are some imaging parameters like ultrasound and MRI, which can help us diagnose the disease early. And we can see the changes after treatment, they become less. We know, okay. And we know that become normal, we can reduce the dose. So that's called treat to target. We have a target. And new drugs, as I told you, there are a whole lot of new drugs. Every year, dozens are added. So there's so much hope. Now, this is a different, isn't it? So this is a relatively older person, and you can see nodules. Someone who is not a rheumatologist may even look like rheumatoid, but it's actually osteoarthritis. This is part of aging. It is part of wear and tear. It's because of trauma. Now, you've seen one cricket umpire used to show the six like this. Like that used to show New Zealand umpire because his finger was bent, the football injury, rugby injury, and it got premature osteoarthritis. So he could not show the six in a normal way. He had to do it that way. So osteoarthritis fingers will be like this, but it affects knees and all the weight bearing joints in the body. And again, osteoarthritis do not have as dramatic medical treatment as in rheumatoid. And sometimes many of them with advanced knee disease have to go for surgery or joint replacement. Now this is, you can see some skin lesions here. This is called psoriasis and nail changes, and this is the joints. What happens is, unlike in rheumatoid arthritis, in this arthritis, the most distal part of the finger joint is also affected. So unlike rheumatoid, never, these distal joints are not affected. So this is psoriatic arthritis. This is very aggressive and very deforming arthritis, and they also have sometimes association with metabolic syndrome, like hypertension, diabetes, and they can have a worst outcome if not treated because they deform very fast. So this is ankylosing spondylitis. You have seen many people. I'm sure you have seen somebody in the street or in your family or relative somewhere. If treated, about 15, 20 years back, when someone had this disease, the whole life was on painkiller and lying down, and people were, when the TNF blockers biologics came, people who were lying down for 10 years, they stood up the next day. So it's like a magic bullet, and ankylosing spondylitis outcome has improved so much. We cannot correct all the deformities. We can still control the inflammation. One thing I wanted to say to everybody is that these are all lifelong disease. And if you stop treatment, they will go on. And even if what appears like a silent disease, if they are tested properly, there is still signs of activity of disease. So at any stage of disease, there is a scope for treatment and improvement. So even in these patients, they may not get completely straightened up, but they can be pain-free, they can move around much better, and they can be a lot better than what they are. Here, this is gout. You can see the big toe is swollen. This is one of the most painful conditions in life. You have gout, they get very red, hot, swollen joint. Even the most mature person or tolerant person will be crying in tears, in pain. The crystals keep pricking the joint. And what happens is the crystals of uric acid salt get deposited like nodules called tophi. And you take some fluid from here or here, you can see under microscope crystals, sharp crystals. So this is gout, and this is more common in the Western population. But again, lifestyle has some role, like the alcohol and very rich food. People with hypertension and diabetes and kidney failure, a little higher problem, a higher risk of gout. And this is a condition, it's not truly a joint inflammation. But as I told you, they feel the pain. It's not they're malingering, or they're just fiending, or they're just sort of, acting for a gain. No, it's not. It's not for a gain-seeking behavior. They have pain in this. These are the red spots given at the different parts of the body. Especially, they have those points are tender. They can have widespread pain. They have altered sleep. They have more of restless sleep. You know that, no, sleep, we have two types of sleep. A type of sleep where you have restful sleep, we become fresh, and that comes only early morning or late night. Whereas early part of sleep, and initially the sleep is full of dreams, and that is like rest. This is not like a rest. During dream, you can even swim, or you can even walk, you can even do all kinds of things. The muscles are acting. When you're dreaming, you are swimming, your muscles are acting. So you don't get the rest. So people with a more of REM sleep, less of restful or slow wave sleep, and they have a lot of stress. They have abnormal chemicals in the brain called substance P is produced. And the sleep inducing chemical called serotonin is less produced. So they get pain all the time, tiredness all the time. And you touch them, they just jump. And usually it is middle-aged and little older women. And many a time they are mistaken or misunderstood by many people. And it may be primary, or it may be associated with many autoimmune arthritis like rheumatoid or Sjogren or lupus, can have fibromyalgia. Ankylosing spondylitis can have fibromyalgia. But it may be just this without any other disease. So you examine the joint, no problem. You do the blood test for inflammation of ESR and CRP, no problem, they're normal. But you touch them, they wins. So do they mean they're just crackpots? No, they are not. They have, the pain they feel is real. Their pain threshold is low. So if I pinch with the same force to you and 10 other staff in your office, each one will express differently. One person may not say anything. One person may wince and cry. Others will be in between somewhere at different levels. So the perception of pain and expression of painful stimuli by each human is different. So fibromyalgia has a very low threshold for pain and high perception of pain, and they suffer from pain. It's like a pain cycle, pain begetting more pain. So to cut the cycle, a lot of lifestyle cycles are changes are needed. Sleep cycle has to be altered. All they need to be doing a lot of activities like aerobics. They need to do a lot of physical activity to balance the chemicals in the brain which control the sleep. So this is this is a type of joint pain which is not truly an arthritis that way, but this is also felt as a joint pain. So what I'm trying to say that there's so much variety. I've only shown you 5 slides. As I told you, there are more than 106 types of arthritis. And rheumatologists are the right doctors for you. There are good treatment for it. You have to understand properly about your disease. You have to get the right information from right source, apart from doctors. Please don't do doctor shopping. You have to stick to your rheumatologist, and maybe you can take a second opinion, but you need to follow up with somebody. Do not get misguided by misinformation. Do not become apart from arthritis, do not become a patient of idiot syndrome. So arthritis has lots of hope, and I would like everybody to understand that the scientific, biological, rational, evidence-based modern medicine treatment is very good, goes a long way in not only controlling your pain and swelling, but improving your quality of life, regaining uh, your function of your body, and also increasing productivity at home, at workplace, and to the society. Thank you. Good luck to everybody.
Thank you so much, Dr. Danda. Thank you so much for giving us all this information on Saturday. Wish you have a great time. Take care.
Thank you. Thank you very much. You too.